Hey, I'm Dr. Owens at Owens Dental, and I want to talk to you guys today about Invisalign. We get a lot of questions regarding Invisalign or clear aligners, and so I want to put some of those questions to rest and let you guys know a little bit about them. Invisalign is a type of orthodontics, right? So orthodontics just means that we're moving teeth. And so there's different ways you can do that. You can do it with traditional band and bracket and wires, braces, or you can do it with clear aligners. They're both going to accomplish that goal. So they're both going to move teeth. They compare very similar in that, but other than that, they're very different. Clear aligners have advantages in that they come out of your mouth. So what is the advantage to that? Well, the advantage is that you can eat and drink basically whatever you want. There's no restrictions because you're going to take them out to eat and drink. Also, your oral hygiene habits don't change. So you can still brush and floss the same, so the incidence of oral decay is not increased. So those are some advantages. Whereas with brackets and wires, oral hygiene changes, right? Because you can't floss and brush as easily. So you have to be very diligent with that in order to prevent tooth decay. Also, you have to be careful with what you eat. Hard, sticky things can knock brackets and wires off, so you have to be really careful with that. They can be. That's a case-by-case basis. It really depends on what the teeth are, what the teeth look like. It depends on the patient, on the bone. There's a lot of things that go into that. But in many cases, they can be, yes. Well, because you don't have those metal projections coming off your teeth everywhere that can, and you've probably seen dental wax and things like that we've used for years with kids, where the little wires kind of cut their lips and things like that. So wires and brackets just have a lot of sharp little edges, whereas Invisalign doesn't have that. You also have the advantage of the fact that they come out and you can take them out to eat and things like that. Again, case-by-case basis, it really depends. I've seen it take, anywhere from 5 to 6 months to take, up to 18 months. It really just depends on the case. So the process is you'll come in and you'll see me. We'll go over any questions that you might have, go over, exactly what to expect, how to wear the aligners, and we'll start with, we'll go over fees and prices as well. And if all that looks agreeable to you, then we'll go ahead and start with taking some pictures of your teeth, taking some impressions or molds of your teeth, and we'll send that off to Invisalign, where at that point, I'll get to design your smile on a computer. Once we do that, Invisalign will print or create all the clear aligners from start to finish for your teeth. So it's pretty neat. We'll already know what your teeth are going to look like at the very end. You'll come back in. We'll go through a process where I'm fitting you for the trays, putting the trays in. And then after that, I'm going to see you about every 6 weeks where we're doing checks and try-ins, and I'm giving you new trays just to make sure everything's following the course properly. So clear aligner trays are the little trays. They look like bleaching trays you might have seen. They're clear. They fit closely to the teeth. You're going to switch those out usually about every week, depending on the case, but usually every week to a new tray, and that's how they move the teeth. They're just a little different shape each tray. How many you need really depends on what we're trying to accomplish, what your teeth look like before we start, and how far and how much movement we're trying to get on your teeth. So that's just dependent on the case. The most important time is actually while you're sleeping, because we can leave them in undisturbed for, 8 hours or more in many cases. So we're getting really good movement while you're sleeping. So it's important to wear them while you're sleeping. Sure, there's some cases, it's not very common, but there are some cases where Invisalign doesn't work well. These are rare cases, but that's something that we would evaluate and look at when you come in for your appointment. But yeah, sometimes there are, but it's pretty rare. We fix cross bites. So just to be clear what a cross bite means, that's where the bottom teeth are in front of the top teeth. And yes, we can correct those in many cases. No, they're not painful. Most people tell me that it's less than regular braces. The worst case you might need is a little ibuprofen on the first day you put them in, because they're pretty tight sometimes. But no, I've never had anybody tell me they're painful. If your coverage covers orthodontics and it covers your age group, then yes, they will cover it. That really just depends on your individual policy, and that's something that we will check for you. You don't have to worry about that. We'll check that out for you. It ranges because it really depends on what the case looks like. So I'll give you a range. Invisalign is really neat because it comes in a full comprehensive package where you can really almost no matter what your teeth look like or how they are before, we can do movements all the way down to little baby versions where you just need some little minor movements. The great thing about Invisalign is it's not just a one-size-fits-all, so there's different prices depending on what you need. The highest bracket is going to be in around the $4,500 to $5,000 range. That can go down significantly less depending on what your particular case needs. So all you got to do for that is just give our office a call, and we'll be happy to get you in. We do clear aligners very, very frequently. We'll take a look at your case. We'll see if you're a good candidate for it and what would be needed in order to do it. So I hope that answers your questions, guys. I want you to make sure to follow up with me. Give our office a call. We do many, many cases like this, and we'll be happy to sit down with you, take a look at your case, talk to you about what you can expect, what it'll look like, give you an idea about what to expect going forward with orthodontics or with clear aligners, and then go over prices as well. Answer any questions that you have. So come see me, and we'll get with you soon, okay? Thanks.